Hi, and welcome to Steps to Stride. I'm Connor Ratcliffe, and we're back in the garage gym today, and we're looking at some potential loading strategies for our calf, Achilles, and our plantar fascia. Now, today's exercise is a double limb tiptoe raise, another one. But this double limb tiptoe raise is up on two legs, down on one. We'll also look at a potential regression with this, where we'll look at some weight shifting as a bit of a bridge between up on two, down on one. And really this whole exercise is a bit of a bridging exercise for our patients where double limb's a bit too easy, single limb's still not very well tolerated or a bit too challenging, but we want to get them from that distributed load over two limbs to that full weight bearing through single limb, because we spend lots of time when we're walking, running, doing other activities in a single phase of support. So we need to get that tolerance back and full capacity to load with full body weight through a single limb. So like all our weight bearing tiptoe raise exercises, just be mindful of load on forefoot when we're doing these for reps, because we don't want to overload and cause a problem in the forefoot region. So nice soft mat, plush carpet, or you can do it in trainers, but just be aware if you've got a big drop or offset, so you've got a big heel raise built into the trainers, that's going to limit the range of motion a little bit, and that might affect the therapeutic outcome of this exercise. So for this one, I think it makes good sense to actually take balance out of it, because we're going to come up on two and shift weight into a single limb position. That's going to be quite challenging from a proprioceptive or balance perspective, so we're going to hang on to something for this. Now, the only other thing we need to consider here is our typical 1-2-3 tempo. So up for one concentric, we're going to hold for two isometric, and then we're going to come down for three with that eccentric bias. So we'll do a couple of reps, and we're going to come up on two, shift our weight onto one, and then come down on one. So it gives us that bridge. It takes the concentric element out of this and makes it a little bit easier and safe. Starts to bridge that gap from double limb to single limb. So we're going to come up for one, hold, shift into a single limb, then come down for a count of three. We'll rinse and repeat on the other side. So up, hold, down, nice and slow. Now, if our patients are still finding this a little bit too challenging and are struggling with that full weight shift and can't perhaps still tolerate full body weight on the way down, that's where we can start to implement this weight shift. So you can actually get kind of hands-on with your patient and they've consented, and apply a little bit of like an external force. So you can act as a bit of a kinesthetic cue, and you can gently shift them into load, or you can just give that verbal augmented feedback. So say stuff to them and give those cues about, okay, well, just shift the weight over. So we can come up on two, shift our weight over. So I'm putting much less load, much less force through my right leg, and then come down. And again, up, shift our weight over, shift our weight over to the left leg, come down nice and slowly. So this can be an incremental shift depending on how much tolerance they've got, and you can start to see how this helps to gradually, progressively get to where we need to be in terms of full tolerance, full capacity through a single limb loaded position. So we'll just do it again. We're going to come up, we can shift a bit, shift a bit, shift a bit, shift that body weight. So now most of the force is going through, but it's still not as much as if I remove right leg, and then we can come down nice and slowly. Now, what's worth remembering is that this is intentionally cued weight shift. So what you might sometimes find is that you get unintentional weight shifts. And that's one of the downsides of sort of double limb exercises. If you do have a bit of a pattern of compensation, where you've got pain unilaterally, then you might find actually, well, if I've got loads of pain on my left leg, people might naturally shift that weight and that load away from the painful limb. And that's a useful compensation strategy, but if we're not looking out for that, then that unintentional weight shift might mean actually we're not really loading up the limb we want to, and we're ending up then with kind of an uneven amount of strength from left to right, or ipsilateral, contralateral, whatever term you want to use. So just be aware that this is a very intentional weight shift, but when you're giving double limb exercises to patients, perhaps for other reasons, or to load other structures, whilst it's a time saver, because you can do both legs at once and you can add external load to still hit therapeutic range. So if you've got time poor patients, double limb can still be useful. But if you've got lots of pain and ingrained altered sort of movement patterns, then just be aware of those unintentional weight shifts, which might mean actually you're not getting full load and equal load through left and right limbs, which might lead perhaps to a little bit of an imbalance, or not actually hitting the target structures equally on left and right. Anyway, that's today's exercise. It's a double limb tiptoe raise, up on 2, down on 1, with me rambling on a little bit about some possible bridging regressions with our weight shift.